Hello everyone, and welcome to Your Health, Your Choice. I am Dr. Roopnarine, and we are coming to you live from our studios at ACTN. Today is Wednesday, the 1st of June, 2022, and on tonight's program, we will be discussing men's health. Back in studio with me tonight is Dr. Satyendra Persaud. Dr. Persaud is a consultant urologist at the San Fernando General Hospital. Dr. Persaud also has offices at the SurgiMed Clinic in San Fernando. As usual tonight, our numbers should come up at the bottom of your screens, and we'll do our very best to answer each and every one of your questions during the show. So guys, it's an early Father's Day special. Tonight, myself and Dr. Persaud will be speaking about men's health. So let's get the show going, and let's say welcome back to Dr. Satyendra Persaud. Sati, welcome back to the show.
Hey, Robin. nice to be here again. You know, it's always nice to have a conversation with you and go through these topics. You know, we can really help folks out there with some information. You know?
Very good, Sati. It's a pleasure to have you back. And the last time you were here, Sati, we had a lot of interest. You know, we were discussing kidney stones, urinary tract infections, and we had a lot of interest, a lot of feedback. People were calling the studio, people were talking to Josh, people were calling myself, and they wanted us to expand a bit on some of the topics that we discussed last time. All right? So, Sati, let's just get the show started with the first thing, right? And a lot of the times, people will come into the clinic, they're coming to see yourself and myself, young men, even teenagers, and sometimes they complain about testicular pain or pain in the testicular groin area, and sometimes even swelling. It might be something that they might not focus on, it might be something that comes and goes, or it might be something that comes on acutely, but it's something that people generally tend to shy away from discussing. It's something that is not really discussed in the public arena, but it's something extremely important, men's health, and indeed pain in the testicle, it needs to be addressed. So Sati, if you could just give us a little outline as to what may be causing sometimes if a patient comes in, how would they investigate this pain in the testicle, what causes it, and how would you approach such a patient?
So testicular pain varies by age group. So for young men, and there are certain things that we worry about more than others, right? There are a number of causes. There are infectious causes, so the testicles can get infected. You can have a testicular tumor. You can have fluid around the testicle, sometimes what you call a hernia. Where the bowel comes down, that can cause pain as well. Some people get hit in the testicle. What we worry about is the testicle. In young men, what we worry about is something called testicular torsion. Right. So imagine the testicle as a cherry on a stem. Yes. And the cherry is twisted, but the blood supply is coming down the stem. Right. So when you twist that blood supply now, it only has one blood supply. Right. So when you twist that testicle, and there's an abnormality where the testicle isn't firmly anchored in the scrotum. And so in young men, sometimes it just twists. And testicle can actually die, and sometimes it's mistaken for other things. It might be mistaken for just an infection, and it's treated. And you have 6 hours to treat this, or else just the other day I saw somebody who had a missed, it's called testicular torsion, and it was missed, and the person came in 5 days later and lost the testicle.
So Sati, I think that's a really important thing that you're bringing up, because you went immediately for the most important cause of testicular pain. So torsion, how does it come about, testicular torsion?
So what happens is, we can go to the next slide that has testicular, right? So if you look there, that's a normal testicle to the left of your screen, and to the right of the screen is a testicle that's twisted. Where it's twisted is where the blood supply comes down into the testicle. And some people have a genetic abnormality where the testicle is not anchored to the skin in the scrotum. And for whatever reason, the testicle starts to twist, and it can happen acutely. You can be asleep and you wake up and the pain is excruciating. Often they come in the office limping. They're not allowing you to touch the testicle is swollen, and because it's twisted, you imagine the testicle will rise up because it's twisted and shortened. So you get that testicle that's abnormally placed and higher than the normal side. And we worry about that.
What age group is that?
It's usually adolescent men. I mean, I've seen it in older men, but by and large, the most commonly happens in adolescent boys. Right. So that's why it's important, because they're going to hide this, right? Oftentimes they're ashamed to come to their parents. Exactly. So you need to educate them, and I mean, this is what this program is about, right? Yeah. So you need to educate them that if it hurts, you need to tell somebody, because I tell people time is testicle. Yeah. So if you miss and you don't catch this in about 6 hours, your testicle could potentially die and you lose a testicle.
All right. So I think that was one of the main reasons why you wanted to come on this program tonight as well, to highlight something so important. Now, all right, so is it that they wake up suddenly with pain? Is there something that might have triggered it off? I mean, I suppose young guys being athletes, running, playing football.
Sometimes you can have a history of trauma, and you shouldn't let that distract you that they might have hit the testicle.
Yeah.
If you're not sure, just get a second opinion from a urologist.
Right. So they get up in the night, the teenager or the young adult male, and they get sudden pain in the testicle, so they should make their way straight to the emergency room?
Yeah, and if you as a doctor think that this is testicular torsion, that's an emergency and that needs to go to theater.
Right.
So spending 4 or 5 hours to get an ultrasound is time lost.
Yeah.
Right? Because what you need to do is restore blood supply to that testicle.
Yeah.
And you need to bear in mind also that what's happening on this side that's affected, where it's not anchored properly, the same thing is happening on the other side.
Right.
So when you open that testicle, you have to stitch it down so it doesn't move.
Right.
And you have to do the same thing to the other side, because it would be a shame if you fix it today and then in another month the other side twists.
All right. This is probably one of the truest emergencies in urology, I suppose, is it? It's a true emergency.
It is an emergency, and you should go straight to I usually, if we have testicular torsion, we're bumping anybody that's above us to get cases done.
All right. So Sati, what other causes? I mean, that's the most dramatic case that you gave us, right? And the most important, and I appreciate that. But what other causes could someone have of pain in the testicle besides torsion?
Yeah, so infection, we see that a lot with STIs. So there's a slide. Up there, So there's torsion there, infection, trauma, inflammation. There's hydrocele, which is a collection of fluid in the area adjacent to the testicle. This varicocele here is like, if you have varicose veins in the legs, it's basically the same thing going on in the testicles. And you see this swelling, or the man might feel the swelling. It's classically described as a bag of worms. Right. Imagine a bag of worms and you're feeling it feels squirmy and squishy.
Yes.
And if they feel this sensation of heaviness or dragging in the testicle.
Right.
And that's important because it can actually, long term, it means the blood isn't draining out well out of the testicle.
Yeah.
And it can actually, testicles can die.
Right.
Infections are fairly common as well, and it varies between young men and old men. So in old men, it's usually as a result of like enlarged prostates or a stricture, and they got infected urine, and remember, everything's connected. Correct. So the testicle is connected to the urinary tract.
Yeah.
So the infection can go into the testicle.
Yeah. For
young men, a lot of times it's STIs. So when we see young men, classically less than 35, we usually treat them for both UTIs and an STI as well.
Sexually transmitted infection.
And arrange to get them tested.
Right. And how would you treat the patient with testicular pain? Is this the same way? Just whatever the cause is, you treat the determined cause?
So as always in medicine, a careful history, examination. Often you can just pick this up from the history. So history, sexual history, examination.
Right.
And you might augment that with blood tests and an ultrasound. Ultrasound is very important as well.
Okay.
I mean, if you feel a testicular mass, and this could potentially be another cause of pain, although testicular cancer can be painless.
Right.
You should get an ultrasound just to confirm.
So that's the painful testicle. Now let's move on a little bit to something very important that people don't really talk about enough. Testicular cancer of the testicles. How does that present in a man, and how could we pick it up and prevent it?
So it can present with testicular pain, but a lot of times it's or a swelling.
Yeah.
A lot of times it doesn't.
Doesn't, exactly.
So the best thing you can do, I mean, a testicular self-exam is easy to do.
Right.
And you can do it once a month when you're having a shower.
All right. Let me ask you, how common is testicular cancer?
It's not common. I mean, prostate cancer by and large is the most common cancer by far among men. Testicular cancer, we don't really have good data on it, as with most cancers in Trinidad. But it's not uncommon. You
worldwide,
see it from time to time.
How common is it worldwide? Do you know? Or?
It is not that common. It varies by geographic location, but it's probably about 6 or 7 most common.
Okay. Per 100,000.
No. In terms of where it ranks. So you have prostate cancer, you have bladder cancer.
So it's one of the less common cancers, but it's still there.
It's not uncommon. I can tell you that, but it varies by geographic location.
Is there? I mean, in Trinidad, we like to talk a lot about like diets and chemical exposure. Is there any cause of testicular cancer? Is there common causative agents?
Yeah. So the epidemiological data varies, but there's some evidence that maybe HIV, there's genetic genetic influences. If your father had testicular cancer,
right,
you have a higher chance of getting it. If you have testicular cancer on one side,
yeah,
you have a higher chance on the other side. If you have an undescended testicle,
yeah,
which is important to pick up in children or in babies, if you have an undescended testicle and stays down for any length of time, you have a higher risk of getting testicular cancer.
All right. Sorry, go on.
Right. So if you've had a history of it before,
yeah,
you have an increased risk, and then certain genetic conditions like gonadal dysgenesis and so on.
All right.
And this is just a photo there, how it might feel. So there's a lump on the actual testicle itself.
Right.
So you might feel a little bump there. And
right,
if you feel that, you should go see a urologist, and he'll get or she will get an ultrasound.
I think you have a slide there with how to do a testicular exam, self-exam.
I mean, I would encourage. This is difficult to see, but I would encourage you.
Can you go through
Unfortunately, we can't demonstrate it.
No.
But we can't demonstrate it accurately, but I would encourage you to just Google this.
You said you wouldn't want to put that. But let's go through it. Let's go through it. Let's explain how to do it.
You want to do it. Can we put that slide back up again?
Yeah.
So there it is. You want to hold the testicle firmly, and you want to systematically kind of roll your fingers, hold it firmly, and just roll your fingers over the testicle. Feel the testicle. You need to familiarize yourself, as it says there, with how the testicle feels. So there are different parts of the testicle. You know, the testicle, and then there's the epididymis, where the sperm kind of hangs out before it's ejaculated.
Yeah.
And you want to familiarize yourself with how that feels. And once you're familiar with how normal feels, if you develop anything abnormal in the future, you'll be able to tell. Right. You'll be surprised how many men don't examine their own testicle, which is something so simple to do, and it could potentially save your life.
Yeah. And you say this men should do this exam how often? Once a month?
Yeah, I mean it's so easy to do, right?
Yeah. But they practically do it without realizing they probably do it.
You probably do it without realizing, you know. But if you do it systematically and you check both sides, and you do it in the shower where it's soapy and your hands flow easily over it.
Yes.
Yes. If you do that once a month, that's good advice.
What is the age group that suffers from testicular cancer? Is it only older men?
No, actually, unlike prostate cancer and kidney cancers and bladder cancers, this is a disease of younger men, you know, young to middle-aged men, so 14 to 40s. 14? Yeah, young people, you know. I lost a friend in high school, table tennis player, to testicular cancer.
Wow. Okay. So basically, Sati, I mean, that's really important information you're putting out. I mean, you yourself lost a colleague when you were in high school.
In high school, yeah. Promising table tennis player for Guyana. For
Guyana. So what you're saying is, maybe we should, at the age of 14, 15, you should start examining testicles to check it, or what age?
If they can do that, certainly if you have a mature child that you can talk to them about this. Yeah. But certainly young men. Yeah.
But Sati, why is this important as well? These are the kind of conversations parents need to be having with their kids.
Yes. And the thing is, testicular cancer is so treatable, right? Yeah. Nobody should be dying from testicular cancer. I mean, even if you find a testicular cancer that's spread outside the testicle, the cure rates are very good. Okay. And especially if it's confined to the testicle and you catch it early, survival is 99%.
Right.
So the key there is to catch this early.
Right. And I think sometimes a little bit of embarrassment, because even discussing a topic like this on air, some people might consider it taboo. Yeah. It's not something people speak about in the public domain in Trinidad and Tobago, and it's not something that parents are comfortable speaking to their sons about. Fathers are comfortable speaking to their sons about, but it is a conversation that must be had, because it's your health. Yeah. And it's part of your body. Correct. And there's nothing to be ashamed about.
And you need to have you need to destigmatize these conversations and have them with your children, because look at this child that about 30, I can't remember his exact age, might have been 13 or 14, that lost his testicle because part of it was his doctor kind of missing the diagnosis, but the other part of it was him waiting. Because he was kind of ashamed. Is when his mom saw him limping, then the mother kind of forced the issue and asked him why he was limping. Right. And then that led to a discussion.
Was that a torsion of the testicle?
It was a torsion. It was a mixed torsion.
Right. Right. So I mean, those are the common causes of lumps and pain in the testicle, and you went through a bit of the testicular cancer as well. I just wanted to, a little bit off course to what you mentioned, but because we're talking about kids as well, tell us about circumcision. I know I didn't really prep you for that as well. I didn't discuss that, but it seems that it's less common nowadays than it was before. Is there any medical necessity at any point in time for circumcisions? And is it recommended? Is there any benefit to circumcision? And what age group would circumcisions be done on?
So my practice, I don't really see children.
Yeah. Of course.
And I think circumcision for phimosis is probably, phimosis is when the foreskin won't retract, right?
Yeah.
And often parents will get nervous that the foreskin isn't coming back.
Yeah.
If you give that child some time, if you give them till, a year, 2 years, just watch them.
Yeah.
Eventually, most of them, the foreskin will come back.
Right.
Some people do it for religious reasons, and that's okay.
Yes.
But before we rush to circumcise all these children,
Yeah.
I think we should give them some time.
Right.
And I think my colleagues in pediatric surgery probably agree with me.
Yeah.
The main advantage for circumcision is in terms of hygiene.
Yeah.
And by extension, children who are circumcised rarely, if ever, go on to get penile cancers.
Okay.
It's protective.
Okay.
Right? There's a decrease in spread of HIV as well with circumcision.
Right.
Right? So that's why they've circumcised these men in these countries where HIV is endemic.
All right.
And there are medical reasons. We see a lot of men with phimosis where for whatever reason the foreskin is tight.
Older men.
So it might be diabetes related.
Diabetes.
They might have had balanitis, we call the inflammation of the glands and the foreskin.
Right.
And so it scars down, and it's very difficult for them to retract it.
Right.
They have another thing called lichen sclerosis where it becomes very tight and scarred, and it's very difficult to retract. And circumcision can change the life.
Right.
I'm actually operating on an elderly gentleman tomorrow, and he's completely. When I saw it, I didn't know how he was passing urine.
Yeah.
It's completely scarred, but he's struggling, and circumcision could change his life. A simple half-an-hour procedure.
Exactly.
So those cases are medically necessary. Yeah.
A lot of times, I used to have a fairly sizable pediatric in practice in the past, and a lot of times the parents are bringing the kid because the foreskin isn't going back, and they worry.
Give it some time.
Exactly. So I mean, what you say is give it some time.
Give it some
maybe
time.
keep trying to retract it a little bit.
Yeah.
And
if there's a doubt, see a potentially a pediatric surgeon.
Right. And,
usually they'll wait till about 2-3, I think.
Yeah.
I mean, as I said, I don't really see children in my practice. So most of my are older men. No.
Exactly. All right, Sati. So now is a good time for a little break. All right. So guys, we're going to take a little 1-minute break, and when we come back, we're going to have a further discussion. Probably we'll speak about erectile dysfunction. We're here with Dr. Satyendra Persaud, consultant urologist. I am Dr. Roopnarine, and we'll be back in 1 moment.
You're watching ACTN, The Voice. Connect with ACTN The Voice on Facebook or Instagram at ACTN The Voice. ACTN The Voice, your family-friendly station.
ACTN The Voice launches a new and versatile culinary series called Stacy's Kitchen.
Hi everyone, welcome to Stacy's Kitchen. And on today's episode of Stacy's Kitchen, we will be cooking up a Thanksgiving feast. Our rolls are ready and looking yummy. Nothing like a good curry chicken and some basmati rice. So I'm gonna start putting my wings in to fry.
We will showcase how to make tasty international cuisine with our local products. We emphasize meals on a budget with our selected ingredients.
Restez à l'écoute, Stacy's Cuisine. Au revoir.
So you can put how much, depends on how big you want it. So our fish is ready. Oh my God, look at that. Oh my God. Just like paratha, this is lovely.
Join us on ACTN on Monday evenings at 6:30 p.m. Don't miss Stacy's Kitchen, exclusively on ACTN The Voice.
All right, guys, welcome back. We're here with Dr. Satyendra Persaud. We talk about men's health. I would also like to take this opportunity to formally invite you to send in your questions for Dr. Persaud, and we'll answer it as they come in. All right, so Sati, we touched on it a little bit last time you were here about 4 months ago, right? And it's something that is in the news all over the internet. Testosterone treatment in older men. Testosterone is probably the male equivalent of estrogen in the women, you know, and we always hearing about estrogen, estrogen menopause, decreasing amounts of estrogen. The information is out there, but the information isn't out there about decreasing testosterone in men. So can you tell our viewers at home what is testosterone? What happens as they get older and the testosterone reduces in their body? What symptoms do they feel?
Yeah, so testosterone is, as you kind of alluded to, is the male hormone. It kind of makes you male, right?
Yes.
So a lot of times men will come into the office and they just don't feel themselves, you know. We have a slide up where we'll show you some of the symptoms of testosterone deficiency. So we have, what it does is, I mean, after 40, your testosterone starts to drop slowly.
Okay.
Right? Your testosterone peaks in late adolescence and early adult life, and then it starts to drop off later in life.
Right.
So the symptoms can be, you know, differences in mood. So they feel depressed, they find that the memory isn't there, they're losing muscle mass and gaining fat. A big one is low sex drive and erectile dysfunction, low semen volume.
Yeah.
The testicle might be smaller than normal.
Yeah.
And they just don't feel themselves. They feel fatigued, they feel tired all the time, they're always dropping asleep.
Yeah,
you know, they just don't feel, they just don't.
I mean, we won't expect an older man to feel like a young man, like a young boy.
Yeah, but I'm just talking, not just tired from just, you know, you and I work long hours, you know.
Yeah.
But not just that kind of tired when you come home at the end of the day, boy, I'm tired.
Yeah.
This is just feeling exhausted all the time, combined with other things. I mean, if you go to the slide after that, there's actually a questionnaire which you can actually go through with these men.
Yeah.
So, you know, you ask them, and you can find this on the internet in electronic form.
Yeah.
If you have a decrease in sex drive, lack of energy, decrease in strength, you don't enjoy life anymore, you're sad and grumpy, erections are less strong, if you're falling asleep after dinner, if you feel sleepy all the time and just your work isn't what it used to be. You know, and the big red flag ones are erectile dysfunction and decreased in libido. So libido just means your urge to have sex. So you don't have that sex drive before, and often the partners will notice it.
Right.
But it might be so insidious that they don't put two and two together.
Yeah.
And when they come and they go in the office, they're classical low testosterone, and then you just check the testosterone, and the testosterone below 300 is what we use as a cutoff.
Right.
And to make the diagnosis, we usually repeat it. So you have to repeat it. You have to do it in the morning.
So they come into you with all those symptoms. Well, this is kind of clues in the patient at home that they might have low testosterone, that kind of questionnaire.
Yeah.
So they come into you, you do the blood test, and if it's less than 300...
in combination with these symptoms?
Yes.
If it's less than 300, we usually repeat it just to make sure.
Of course.
And treatment is available. You know, there unfortunately not as much, there's so many different options worldwide, just not in Trinidad.
Yeah.
What we have in Trinidad that we use most often is, as you would know, the injections, libido, which is fairly convenient for patients. You know, you get an injection today, 6 weeks later, and then every 3 months.
Right.
But you have to check the testosterone periodically, and there are a lot of other things. You can't just close your eyes blindly and give people testosterone.
Yeah.
You have to check the lipids, you have to check their PSA, which is the prostate test for prostate cancer. You have to check the blood counts because testosterone can raise your blood count.
Yeah.
So you don't want it to go too high because then they can get clots.
Right.
You have to check the liver function because, you know, some forms of testosterone can damage the liver.
Yeah.
You know, so you have to monitor these men carefully.
Right. I think I've seen a lot of the in America really they use a lot of testosterone therapy, much more so than we do.
And they're marketing directly to the patients, you know.
They're marketing.
That law change where they can just market to the patients. So everybody's
they can market it
directly.
But what I found kind of curious is that they also put out like a lot of supplements, testosterone boosters and testosterone aids, and you see a lot of tablets out there in the market. A lot of them are finding its way into Trinidad as well, and people are selling in the pharmacies testosterone booster. You take this, some of it might be natural combinations of different herbs and so on. And what do you think about those?
So this comes up with testosterone and with enlarged prostate with saw palmetto.
Yeah.
And I had a discussion about one of the gentlemen selling in one of these natural stores about saw palmetto.
Yeah.
And the same thing with the testosterone boosters. The data is not going to be as robust as with, if I give you testosterone, it's going to raise your testosterone. By and large, it's going to raise your testosterone.
Right.
Some of these herbal pills, one, you don't know exactly what is in them, and it's not well studied.
Yeah.
So is it going to raise your testosterone? I can't say. And there's so many of them. There's a proliferation of them, as you said. So I can't tell you if it's going to raise your testosterone or not. No. Is it going to do any harm? Probably not.
Yeah.
But it's not backed robust with that kind of robust research.
All right. So 10 years ago, maybe 15 years ago, we'll get to the treatment there. You tell a doctor you want testosterone treatment, or you mentioned testosterone 10 to 15 years ago, and the whole room lights up, and people are like, oh my God, that's so dangerous. Why are you giving the patients that? Why are we even talking about that? He's going to turn into Hulk, and he's going to become violent, and he's going to have roid rage. And there's so many side effects and problems with testosterone usage. What do you have to say about that?
No, but there's a difference between taking testosterone if your testosterone is low and taking testosterone if your testosterone is normal, right?
Right.
You want your testosterone to be in the mid-range and normal.
My point I'm getting to, what are the dangers of testosterone treatment?
Right. And one thing we should also point out that we see a lot of, these are good opportunities, pitfalls.
Yes.
Testosterone for low sperm counts.
Yes.
Right? This is one of my little bugbears. A man will go to his doctor for a low sperm count. He does a semen analysis, try and get pregnant.
Yeah.
He's found to have a low testosterone.
Yeah.
The knee-jerk reaction is to give him testosterone. And what that does, it shuts off your innate ability to produce testosterone.
Yeah.
And your reproductive, how you produce sperm depends on your cycling of your hormones. So what it does is it actually drops your sperm count.
It has a negative feedback.
So it does actually drop your your sperm count starts at 10 and it goes to 5 or it goes to 0. Right. But some of the potential side effects are alterations in mood, as you said, maybe a little bit to increase aggressiveness, and it doesn't happen for everybody. Raising your blood count, raising your liver function testing, effects on your lipid profile as well. People have gotten, if you raise your blood count high enough, your blood becomes essentially too thick, in putting it in layman's terms, and you can have clots. Right? They can have breast tenderness as well.
So how do you measure that sort of? Is it the concentration that is titrated with the patients, or? Yeah.
So we will check the testosterone periodically. It doesn't have to be too often, every few months. At least when they start.
Yeah.
Once they've started, we'll check the testosterone.
All right.
So and that's up to your doctor. So your urologist will guide you.
Is there increased risk of cancers with testosterone treatment? Prostate and testicular cancer.
So there.
Have you seen it before?
No. So there's this fear because of testosterone's role in prostate cancer. For treating advanced prostate cancer, we lower testosterone.
Yes.
So the reaction to that is, well, boy, maybe if we raise testosterone levels, you're going to cause cancer. But that's not been so. And what we've found is that even though it's a black box warning, so even though it's on the box that if your PSA is raised, you shouldn't get testosterone, so most people would probably adhere to that.
Yes.
Even in men who've had prostate cancer treatment done and the PSA is 0 and well controlled, they can potentially have testosterone too. That's not unsafe.
Right.
But that's a discussion to have with on your individual basis. With your urologist.
All right. And I suppose you could go through some of the different, other than the injections, what other forms of testosterone are available?
There's so many. I mean, there's the transdermal ones. So there's ones that you can rub on your skin.
Yeah, you can put up that slide there, Josh.
Yeah.
Yeah, ones that you can rub on your skin.
So, I mean, there's too many to go through here.
Yeah, but
there are a bunch of different injectable ones. There's androgel to the bottom left, which you can rub on your skin.
Right.
There may be Axiron in there somewhere that's actually deodorant. So a roll-on antiperspirant type thing. There's sublingual testosterone. Libido features in the middle there.
But obviously those roll-ons and stuff are much less concentration than the injectables.
Yeah, because you're doing this daily.
Right.
So there's smaller doses over time.
Right.
Whereas the injectables, there's a very specific way to put it in. It's a very oily preparation.
Right.
So you can't put it in with the typical injection sites in your deltoids or in your shoulders or in your leg. You have to put that in the buttock. And there's a very specific way to actually inject it.
Right.
You have to hold the needle a certain way. You have to put it in slowly over 2 minutes. And there's nasal spray. So the good thing about the nasal spray or Natesto, that one doesn't lower your sperm count.
Right.
It's been found to be relatively safe. Yeah.
All right. So is it, I mean, another fear that people may have is that if they take in testosterone, it will shut down their internal supply of testosterone or production of testosterone. Is that true?
That is true. So what happens is, if I don't take it lightly to start a young man on testosterone, right? Older men, I tell them, have you completed your family? And most of the men who have low testosterone would have children or grandchildren already. So for the majority of them, it's not a concern.
Right.
But for the young man on testosterone, if I start you on testosterone now, your sperm count is gonna drop off a cliff.
Right.
Right. So because it does shut off your ability to.
Is that permanent?
No, it can recover.
Right.
It can recover.
Right.
It doesn't always. Sometimes it's sluggish, and different people are different. It's sluggish.
Right.
To recover fully.
Right.
But when you stop the testosterone, it slowly goes back up.
So, I mean, I've heard it being put forward from different patients as well, and some doctors in the States and so on, that it's almost like a antidepressant. It's almost like the patients get back the energy and vigor for life. What do you think about that statement I just made?
Listen, testosterone is more important than just making sperm.
Yeah.
Right? Testosterone is so important for other things. Your mental health, your bone density, your blood count, all these things testosterone play a role in. So it's really your mental acuity. The men who have low testosterone just can't focus. So they're doing the work, they might be an accountant, they can't focus on the work because the testosterone is low. So it really has far-reaching effects. It's more than just, it's a very important hormone.
Right, and I suppose it's something that you would probably start to encourage people to check more regularly. The information is out there now, because a lot of the time men might be feeling low mood, kind of listless, irritable, and you might think, well, it's just life, but sometimes it might be a hormonal cause.
Exactly.
And sometimes all men might need treatment for their hormones.
And it's something that you can treat.
Exactly.
Something that you can treat safely.
Yeah.
You just need to be aware that it's out there.
Yeah.
And seek the right help.
Right. So Sati, let's move on a little bit, right? And let's talk about erectile dysfunction, okay? Because low testosterone might be a cause of erectile dysfunction as well.
That's one potential cause.
What is erectile dysfunction? We mentioned it last time you were here with us 4 months ago. We had a little 2-minute discussion on it, but let's go into more depth. What is erectile dysfunction?
So it's the ability to, or inability to maintain an erection that's satisfactory for intercourse.
Right.
So you might be able to achieve penetration, but not enough to complete it, at least to the satisfaction of you and your partner.
Right.
And it's so common in Trinidad. I mean, we have a high rate of non-communicable diseases, diabetes. And up to today, I was speaking to a cardiology colleague, who was telling me we should start a joint clinic because he sees so many men because of the same thing that's going on in the heart is going on in the blood vessels in the penis. And we'll talk about that in a minute. But there's so many men, and they're afraid to discuss this thing. It's a shame. They'll ask the wife to leave at the end of the consult and then mention it.
Yes.
But it's so common locally, and it's treatable.
Right.
I mean, we have a range of different treatments now, thankfully.
So erectile dysfunction is just the inability to maintain an erection sufficient enough to have sexual intercourse. Now, so the common causes would be the lifestyle diseases,
diabetes,
hypertension. What are the? There we have a.
So you need several things to achieve a good erection. You need nerve stimulation. So you see something that arouses you.
Yeah.
Then the nerves go to the penis, the blood vessels dilate, meaning they get wider, so more blood flows in. So you need good blood to flow in, good blood flow, and you need the blood to not escape outwards.
Right.
And then it goes into these compartments, and the compartments get stiff. Or erect. So you're really dependent on multiple components to all work together to achieve the erection. So if any of those components get damaged, so let's say your hormones are not there,
Yeah.
Your testosterone's low, you have diabetes, you have high cholesterol, very high cholesterol that's not treated,
Yeah.
or you're a smoker, that's a big one.
Yeah.
So some people are smokers, diabetic with high cholesterol and hypertension.
Yeah.
You know, you can imagine how that's going to go
Yeah.
on the small vessels on the penis.
Yeah. Right. So
If there's a blockage in the blood vessel, blood
Yeah.
supply is not going to go down there. And that's what we see mostly.
all right. So are you saying that the best way to treat that problem would be by just controlling your chronic diseases?
Yeah, believe it or not, but control it before it gets out of control.
Yeah.
And the important thing to note as well is that particularly in young men, if you see somebody with erectile dysfunction and they're relatively young, you know, that's a marker for problems in the future with their heart.
Okay.
Right? So you need to ask, because the same thing that's happening in the vessels, in the small vessels of the penis,
Yeah.
is going to happen in the heart. It's just that it predates the heart when it happens in the penis
Exactly.
because the vessels are smaller.
Exactly.
So you see the effects earlier.
Exactly. The arteries in the body are all connected.
Yeah.
It's like a
So
tree
if you have lipids being laid down in your artery wall,
you're gonna have it in your
you're
penis,
gonna have
in
it
your
in
legs,
correct?
in your feet. It's gonna affect all over your body.
100%.
I mean, we just focus on the heart. So what are the available treatments other than control of the chronic illnesses?
So without saying, walk, lose some weight,
Yes.
do some exercising, stop smoking,
Yeah.
eat properly.
So you
this goes
would
a
have
long
your
way.
patients do that for how long before they start to see improvement, or for how long before you move up the treatment?
No. We do that at the same time. Most people
Okay.
don't want to wait 6 months for an erection, right? You know this.
Yes, of
right?
course.
So they don't want to wait 6 months for an erection. So in conjunction with lifestyle changes,
Yeah.
we start medical treatment usually.
All right. But would lifestyle changes alone give them a solution to their problem? Hard question.
Yeah, it might
could help.
make it. It might make it better. It will work, but often
Yeah.
these men require assistance.
Right. Is it because the arteries are very smaller than in the penis and those areas than other parts?
Yeah,
So they get
and
blocked
sometimes the
really quick.
changes are not necessarily reversible. It might prevent it from getting worse.
Exactly.
But the changes might not necessarily be reversible.
All right.
So lifestyle changes will help, but we often have to use them in conjunction with medicine. If we go to the next slide. Right. So there are a number of the ones we have in Trinidad. I mean, I haven't really seen Levitra here that we use commonly. And Avalafil is, I don't believe the Stendra is here as yet. But we have Cialis available and we have Viagra. You would not believe, I mean, you probably get this too, that men are afraid to take Viagra.
Yes.
Right?
Yeah. Because they hear horror stories.
They hear horror stories,
Read
right?
horror stories in the papers.
They read horror stories. So I usually start with Cialis because
But
Cialis.
address that directly, Sati. Is Viagra safe for people to use? And why is it that some people complain they get side effects or problems?
You know, these things get out there.
But I mean, as far as I am aware, Viagra is fairly safe.
Viagra is fairly safe. You need to talk to your doctor. So if you're a heart patient who's got uncontrolled angina, you're getting chest pain every day, and you're using medicines to spray under your tongue, when you get that GTN, Viagra might not be for you. You might need to see a cardiologist. To see one, if you're fit for intercourse. We don't want you having sex and dying in the process.
Yes.
Or if the Viagra is compatible with your medicines.
Yeah.
Right? But in the right person, Viagra is actually quite safe.
Yeah, and it was originally in cardiac medicines where they
They use it for they use these PD5 inhibitors for pulmonary hypertension and so on.
All right. So, Sati, now is a good time for us to take a little break, and then when we come back, we'll push on with the conversation a bit more. All right, guys? So we're here with Dr. Satyendra Persaud, talking about men's health, and I invite you again to send in your questions for Dr. Persaud. All right, guys? So we'll see you back in one moment.
You're watching ACTN, The Voice. Connect with ACTN The Voice on Facebook or Instagram at ACTN The Voice. ACTN The Voice, your family-friendly station.
ACTN The Voice welcomes you to join us for our newest agricultural television series, Harvest.
Welcome to Harvest. We're doing it double again, north and south. This morning we start here in Brazil Village on Bethany Estate with Michael and Jacinta Milne.
You can look forward to a personalized tour around scenic Trinidad and Tobago, showcasing different agricultural practices and teaching us self-sustenance.
So Wendy, you're about to show me your bromeliad house.
Yes,
Oh, this is lovely.
this is what our customers refer to as the mecca for bromeliads.
Explore the many ways to make your harvest right for you.
So our chicken coop is more or less built at a height whereby it's easy for us to go and just remove the wood shavings into our barrow.
Now, you don't plant out your seedlings, you buy the seedlings, right?
Yes, we purchase our seedlings.
Here we are on a not quite monocrop site, but we have rows of tomatoes, rows of sweet peppers, and then you have the Milne's polyculturing.
Join us every Tuesday at 6:30 p.m. Harvest, a new dimension in agriculture.
All right, guys, welcome back. We're here with Dr. Satyendra Persaud. Josh, I think you have a few questions coming in. If you could start up one time, please. Let's get some audience feedback. Sati, why do men die younger than women? Sati.
Well, I suspect this is probably multifactorial. You've seen these ads of men doing stupid things, right? That women would never do, right? Stupid, crazy, dangerous things that women would never do.
And Venus is hotter than Mars.
Yeah. But part of it is the higher risk of cardiovascular disease.
Exactly. That's the key
men.
part
That's
of it.
the key part, right?
Yeah, but I really want to put this out there for women, right? In textbooks and stuff, we always say men are more at risk of heart attacks, men are more at risk of heart
Yeah, we're
attacks.
more at risk of everything, Robin.
Right. However, it's very important that we don't ignore cardiac health in women, because
Absolutely.
women do not present sometimes in the classical way as men would present with chest pain. Sometimes women present quite differently. So in a woman, chest pain, it might not be the classical left-sided coming down the hand into the neck, but any sort of pain from here to your belly button, assume it is cardiac pain and see a cardiologist. A lot of the times in the past, cardiac pain was missed in women a lot more than it should have been, because it doesn't go according to the textbook in women, especially diabetic women, where they get a lot of things called silent MIs. So just having said that, you're quite right.
And that's very important, that in diabetics, because of the nerve damage and so on, they might not have a heart attack with the classical central chest pain going to your.
A lot of the time women don't even get that, and that's very important for our viewers to understand. Anything from here to here is chest pain.
And shortness of breath might be a manifestation of a heart attack.
Right, so viewer, men die younger than women because of probably those things, and I think also as well because of fear, and men sometimes less diligent to check up with the doctors and to keep things under control.
Yeah, it's very much multifactorial.
A lot of phobias, a lot of taboo subjects like we're discussing tonight, cancers of the testicles and so on. So I think women are a little bit more in tune than men, and that's the purpose of shows like this, I suppose, for our population in Trinidad, so men feel comfortable with doctors and get the information and go and seek medical care, and therefore reduce that risk of them dying too soon. All right, so Josh, you have another question, sorry. Is there an age to reach before I can use Viagra? Sound like somebody waiting on a driver's license there.
If you have the right indication, it's very unusual to see very young men using Viagra.
Yeah.
I mean, there might be some young men with familial hypercholesterolemia who have erectile dysfunction early, a genuine cause.
Yes.
When we see these men with these young men with erectile dysfunction, oftentimes it's psychological.
Exactly.
And I will use the Viagra in young men as a crutch to get them started again, and then their confidence takes over, and they just come off it.
That's something we didn't discuss. The psychological impact of erectile. A lot of the time, erectile dysfunction in younger men is nothing to do with your physiological. It's psychological.
It's psychological, yeah.
And
sometimes it's partner related as well. So men will come in the office.
Good point.
Men will come in the office and they will have, my office is not, it's like a confession booth. So people will come in there and we'll have very frank conversation. I tell them, anything you tell me stays here, right?
Yep.
So they'll have the wife, and they'll have two other women, and they can have erections with these women, but they can't have it with the wife. And it's very complex sometimes, and sometimes it's psychological.
Well, sometimes men complicate their own life.
Yeah, men are looking at a lot more pornography these days, and you find young men looking at pornography, and then they go with the partner. They have different expectations, which they're not going to get with the partner.
Exactly.
And then they can't get because they've conditioned themselves so much with the dopamine to expect a certain thing, and they're not getting that with the partner, and then they end up with
Yeah, pornography has a huge negative impact on young men. And for those reasons as well, they're never going to achieve a sort of satisfaction.
I mean, anything that's overdone is going to lead to damage, and I'm talking some of these men are looking at pornography, extensively, and it's impacting their perception of reality. That's what I'm seeing in the office. I mean, I'm not making this up. I'm seeing patients.
Documented,
seeing patients in the office with this young man in particular.
You the actual clinical presentation of it, and not only that, but sometimes the psychological impact. Sometimes not because you're a man or a young man, it doesn't mean that you're mentally or psychologically prepared for intercourse.
So you can't discuss. So when you're having a discussion,
brings a lot of responsibility with it.
Yeah, when you're having a discussion with somebody as a GP or as a urologist, right?
Yeah.
And I know you spend a lot of time with your patients as well, right? So you really need to speak to them properly to find out what's the genesis of this. Are they having morning erections, nighttime erections as well?
Yeah.
If they're having morning erections or night erections, which they can't control, but they're having problems getting erection with their partners, then it might be a significant component. If they're having erections with pornography, but they can't have an erection with the partners, then that's something.
And then, I suppose a lot of times psychological anxiety, stress, you need to deal with that in a different way other than trying to.
It's a stressful world now, Robin.
Yeah, it is. Josh, any other questions? What's the difference between erectile dysfunction and impotence?
We use it interchangeably. So if we say you're impotent, erectile dysfunction is just the more medical terminology. But if you say someone is impotent, they're referring to erectile dysfunction.
Right. And I suppose some people might not even be able to get an erection at all. That would be considered impotence more than erectile dysfunction, I suppose.
Well, it's just varying degrees of erectile dysfunction. So there's mild, moderate, severe.
Right.
So it depends, on the treatment. I mean, we have different treatments now.
Yeah.
So we show the different medicines that we had. We have Viagra, we have Cialis. I usually start men out on Cialis because it allows for more spontaneity. So if you take Cialis tonight, you're probably still going to have some in your system in the morning.
Right.
Rather than have to take a Viagra in the morning. Yeah.
Right.
So I usually start them, and I find the Viagra is a good drug.
Yeah.
But some men are not willing to take it because of the negative connotations with it.
Right.
But they are willing to take Cialis.
So Cialis lasts in the body a little bit longer.
A little bit longer, yeah.
Right. So you could have multiple erections.
Yeah, but you have to take it a little bit. You have to take it for a little bit earlier than you would take Viagra. So you take Viagra about 30 minutes to an hour before. You take Cialis a little bit before that.
And the other part of it is, well, Sati, Viagra is not really going to help your libido, is it?
No. Viagra doesn't.
That's an important thing for people to know.
Yeah, Viagra is not going to help your sex drive.
And then suddenly they're going to have this massive sex drive.
No, and the other thing
they're
is...
going to be disappointed.
The other thing is that if you take Viagra, you can't just take Viagra and sit there and expect the erection to happen.
Yeah, exactly.
Right? You have to do whatever it takes to get that erection. It's just going to help you.
Yeah.
All right? So that's something to be aware. So that's a good point.
Yeah.
It doesn't change the sex drive, and you still need some form of stimulation.
Exactly. All right, Josh, any other questions? Does Viagra pills work?
Yeah.
And are they safe? I think you answered that.
Yeah,
very
we kind of
much
answered that. And there's Viagra and there's generics now.
What about the generics? Are they a good quality, Sati? I mean, I don't want to put you in a spot with the pharmaceutical industry or whatever, but from your experience, is the generic ones of good quality?
Some of them, yes. It comes as Viagra, and it comes for the cost.
It's cheaper.
It's cheaper on the patient, and some of the generics come as 25 milligram pills. So there's 4 25 milligram pills in the thing. So you can titrate. You can try 25, then go to 50. And
I suppose
I'm happy with patients trying.
And that's a discussion for another night as well. Generic medication versus normal branded medication. We'll have that discussion another night. Another question there, Josh, please. Can I accidentally bend or break my penis? Good question.
That's a very good question. You can 100% accidentally bend or break your penis.
All right. Tell us about that, Sati.
So if we go to the first slide with how you with erectile dysfunction.
First slide there, Josh. Yeah, go ahead, Sati, you can tell us.
Before that, the very first slide. So what happens is, right, so if you look on your right, you see that thing that's in pink?
Yes.
That's a chamber in the penis that when the penis is not erect, it's not filled with blood. When the penis becomes erect, it's like a hydraulic system.
Yeah.
It becomes filled with blood and becomes stiff. If you bend the penis when that's erect, you can actually break that chamber. We see that from time to time at the hospital.
Okay.
You know, and what can do it is during intercourse, especially with the woman on top, she comes down on the penis and it bends the penis forcefully.
Yeah.
We just had a very strange case where it happened during an MVA. That's a motor vehicle accident.
Of course.
I don't know how that happened, but that's a case report. That's very rare.
Yeah.
Most of them happen during sex. In Jamaica, when we were in Jamaica, we used to see a lot with this daggering phenomenon, which is a special dance.
Okay.
And you can bend it and it snaps. Because when it's erect, the chamber is very thin and it's stiff, so it actually breaks. And the penis and the blood comes out of the penis. You use the erection right away. The penis becomes very swollen, looks like an eggplant, and that needs repair. That needs surgical repair.
So what happens when the patient? They come straight to the hospital?
Most times you will hear a pop.
Oh my gosh!
So you actually hear a pop, but the thing tears, and the penis becomes swollen and very painful, and looks. There's actually a sign called the eggplant sign. So it looks like an eggplant.
Right.
I wish I had put a photo in there to show you.
That's all right.
Right. But you can fix that early, or some people, like some of my colleagues, will fix it late.
Yeah.
Late meaning they'll wait 2 weeks for the swelling go down.
Right.
Most people will fix it as it comes in.
And what's the healing time on that?
A few weeks. Some people give them medication to stop them having erections. Some people don't, but we stitch it pretty good. So you know.
So in a few weeks' time, they should be back.
And most men are mostly younger men.
Yeah.
Although I did see one 65-year-old who actually broke all 3 chambers in the penis.
Wow.
Yeah.
Wow. Right, Josh. Another question, please. Would testosterone increase my sex drive and performance?
If your testosterone is low and your sex drive is low, if you raise your testosterone, yes, you will see an increase. And testosterone kind of aids the erection, so it kind of creates a good environment for erections. So if you actually raise your testosterone, not only is your sex drive going to go up, but your erections are going to get better as well.
Right. And I think along with that point as well, right? Tell the viewers why young men with normal testosterone should not be taking testosterone supplements. Because the last thing we want is young men thinking this is going to help them during sex.
No, and this is another
testosterone.
Yeah, this is another.
So put out that warning there for the public one time, Sati.
Not just the public, for physicians as well. You can't go about giving people testosterone if you don't check the testosterone. I can't tell you how many times I see that. We don't know where we are because we don't know where we're starting from.
Yes.
And young men, as I told Robin, you're going to drop your sperm count down to 0, right?
Yeah.
So the sperm count is going to come off a cliff. When you come off the testosterone, you're not going to be able to produce your own testosterone for a while. So you just feel terrible, testicular shrinkage, right? Men don't like that, but you see that with exogenous testosterone. Increased risk of strokes, heart attacks. You see a lot of these people who are taking steroids and so on getting
trouble.
Yeah.
Roid rage and all.
So you really don't want to take it unless it's medically necessary.
Exactly. All right, Josh, any more questions there? Why is one of my testicles lower than the other?
That's just how the body is built. I mean, one testicle lies lower than the other. And testicles are outside really to keep them cooler because, a hot temperature actually is bad for spermatogenesis, but that's completely normal.
Right. And in embryology, I think they descended downwards, don't they? They were higher up into the abdominal cavity.
Another thing, I'm just telling you these things as they come to mind, right?
Yes.
Men wearing tight underwear while trying to have children and can't.
Yes.
So I've had a spate of men come in my office for infertility, and they're all wearing two underwear.
2 underwears?
Yeah. I don't know why.
I don't know.
They can't explain it. They just tell me that they're all wearing. You want to keep your testicles. The testicles are outside the body for a reason.
Yeah.
Because it's cooler.
Yes.
You want to keep it in an environment that's permissive to making sperm.
Yes.
Which is to keep it as cool as possible.
Yeah.
Hot baths are a bad idea if you're trying to have children.
Yeah.
Wearing tight underwear is a bad idea.
No.
And especially wearing 2 underwear must be bad for you.
Yeah. Exactly. Josh, any more questions there? I am a female with a lot of symptoms. Can I use testosterone?
She did not specify what symptoms, right?
Yeah.
So if you have any symptoms, you're a female.
Estrogen might be the...
Yeah. So a good place to start is a good general practitioner.
Yeah.
Who will then triage you to the right person.
Yeah.
So if you need to see a urologist, he'll send you to a urologist. If you need to see a gynecologist, he will then send you to a gynecologist. But it's a difficult question to answer because she didn't say what symptoms.
Yeah, I think it's best seen by a general practitioner. Any more there, Josh? What can I use to increase my sperm count?
So again, this is a difficult question to answer because we don't know what's causing the low sperm count.
Yeah.
Right? So many things can cause a low sperm count, from hormone deficiencies in the brain, to hormone excesses in the brain, to medicines that you're on, to blockage. You know, so men often ask if there are a lot of products out there that horrible things.
Yeah.
I mean, probably not going to cause any harm, but I don't have any hard evidence that they work.
Yeah.
You can use vitamins and zinc and so on, multivitamins to antioxidants that might help, but it's not necessarily going to increase your sperm count. But it's a difficult question because what you have to find out is
what causes it.
How low is the sperm count and what's causing the sperm count to be low, right? I mean, men have this obsession with raising the sperm count when it's perfectly normal, right? Leave your sperm count alone. Right? If you have a normal sperm count, that's okay. If your sperm count is low, the first step is finding out why it's low. And the best way to do that is see a general practitioner who will do as much as they can, and then send you on to a urologist who will then investigate further. So there are a number of tests. We test the hormones. You might need an ultrasound. We'll check for the varicocele potentially. We'll examine you head to toe and then find out a reason, and then we can fix that reason.
Is there any sort of causes that might be temporary in nature that causes a low sperm count?
Anything can affect
cigarettes, probably when you come off the cigarettes, does it increase back your sperm count?
Sometimes the cigarettes cause a decrease in the quality of the sperm, you know?
Yeah.
But anything can affect your sperm count, right?
Yeah.
And this is why before we start, we'd say that this is a low sperm count.
Yeah.
We will let you repeat your semen analysis.
Right.
Right? And I usually repeat, I do it at a particular lab in Trinidad. I don't want to run into trouble with anyone.
Yeah.
But they do a very good semen analysis, very detailed semen analysis.
Right.
They're in North.
Yeah.
But we'll have them repeat it because if you have COVID, if you have a bad, and I'm not just hitting on COVID,
exactly,
but if you have a bad flu or a
virus
viral infection, that can cause your sperm count to drop. So somebody comes and says, I had bad flu and I had high fevers and so on, and the sperm count is low, don't panic, just repeat it.
Yeah. Any other questions there, Josh? What is the best diet for higher testosterone? Yeah, Sati, so we have a question coming in there. Josh just read it out to me. What is the best diet to improve your testosterone levels?
I don't know that there's I mean, a good, healthy diet and lots of exercise is probably something to consider rather than a particular fad to just go on a particular diet, you know.
Right.
A diet healthy oils and vitamins and minerals and you know, rather than hitting on a particular fad diet.
All right. So, Sati, we've come to the end of the show. The hour has flown by. But on this topic of men's health, I mean, we had a lot of interest again on tonight's episode with it. I'll give you the final say. What would you like to say to our audience at home, our men at home, on this topic about their general health?
I think
you could watch that camera there, Sati, and you could just give a final closing remarks.
I think that the thing that came up tonight was to destigmatize these conversations and understand that there's nothing you can tell me that I have not seen or heard before. Well, there are a few things, right? But we've heard it all, so do not be ashamed. Nobody's going to judge you when you come into the office. He's seen a lot of this as well, and his colleagues in general practice. So do not be ashamed to have a conversation. Don't be ashamed to have a conversation with your children about these things because it could save the lives. Literally could save the lives, could save a testicle.
Yeah.
and
It's
you
about
know,
healthy
generally
habits.
having dialogue, I think, is the theme from tonight. A lot of these things we talked about could be prevented. We didn't even get to Peyronie's disease, which is the bent penis, which a lot of men have, but they're ashamed to say
We'll
it.
get it on the next
We'll get it
program.
next time.
All right, that's very good remarks there, Sati, all about communication and reduction of fear. All right, guys, so that was a good episode there with Dr. Sati. We learned a lot, and I'd like to thank him again for coming in studio with us. And I would like to thank Josh. He is running back and forth in the studio tonight. It's him alone here tonight. Thank him very much for helping us with his production. We'd like to thank all of you guys who sent in your messages. Fantastic. We appreciate it. Thank you very much. All right, guys, so we'll see you again next week. God bless. Take care, and have a pleasant evening, each and every one of you. Take care, guys.